In this video, I will discuss the underlying physiological problem of multiple sclerosis, symptoms, diagnosis, treatment, and those who may be at risk for developing this disorder. First, let me define multiple sclerosis, which I will now refer to as MS. MS is a potentially disabling disease of the brain and spinal cord, or the central nervous system. It is when the immune system attacks the myelin sheath that surrounds the spinal cord. It causes communication problems between the brain and the rest of the body. It can cause permanent damage or deterioration of the nerves over time. This is an overview of what MS looks like, practically. As you can see, this is a normal nerve ending that has the protective layer of the myelin sheath surrounding it. Now, as you can see here, it is very bare here, which allows for a lot of error on communication. The underlying physiological problem with MS is that since the protective casing surround the central nervous system is being attacked by the immune system, it causes communication problems between the brain and typically different movements of the body. Symptoms can often affect movement and vary from person to person. They include numbness or weakness of one or more limbs, typically on one side of the body at a time, or legs and trunk. Electric shock sensations that occur within neck movements, especially when moving the neck forward. Lack of coordination or unsteady gait is also known as a tremor, and that is also a symptom. Vision problems are also common with MS. Partial loss of vision, pain during eye movement, prolonged double vision, and blurry vision, usually in one eye at a time. The symptoms may also include slurred speech, fatigue, dizziness, tingling, or pain in parts of the body. Sexual, bowel, and bladder dysfunction are also symptoms. As far as diagnosis goes, there are no specific tests for MS. It relies heavily on differential diagnosis, meaning that the doctor has to rule out other conditions with similar signs and symptoms. Usually, this is started with a thorough medical history and examination. So far, there is no outright treatment for MS, but there have been many successful treatments for speeding recovery from MS attacks, like, ready? Corticosteroids. These can be oral prednisone and intravenous methylprednisolone. These are prescribed to reduce nerve inflammation. Side effects include insomnia, increased blood pressure, mood swings, and fluid retention. Now I'm going to wrap it up by talking about those who may be at risk of developing MS. MS can occur at any age, but usually affects people somewhere between the ages of 16 and 55. Women are 2 to 3 more times as likely as men to have relapsing MS. If a parent or sibling has MS, there is a higher risk of developing the disease. A variety of viruses have been linked to MS, including the Epstein-Barr, which causes infectious mononucleosis. Caucasians, particularly those of Northern European descent, are at the highest risk of developing MS. People of Asian, African, or Native American descent have the lowest risk. MS is far more common in countries with temperate climates, including Canada, the northern United States, New Zealand, southeastern Australia, and Europe. Having low levels of vitamin D and low exposure to sunlight is associated with developing MS. There is a slightly higher risk of developing MS if a thyroid disease is present, type 1 diabetes, or inflammatory bowel disease. Smokers who experience an initial event of symptoms that may signal MS are more likely than non-smokers to develop a second event that confirms relapsing remittent MS. Hope you have enjoyed my overview of multiple sclerosis. Thank you.